Good day, I'm Stephen McHugh, and this is your JIS News for Monday, August 24. The Ministry of Health and Wellness is assuring Jamaicans that there is no shortage of COVID-19 beds in the public health sector, even as cases continue to increase. On August 23, the country recorded its highest number of confirmed coronavirus cases for a day, with 116 persons testing positive. It pushes the total number of confirmed COVID-19 cases in Jamaica to 1,529. With health officials now monitoring 622 active cases, related hospitalizations have also increased. But the Portfolio Minister, Dr. Christopher Tufton, says that of the 315 COVID-19 beds available, 73 are currently occupied.
Now, it does show an increase in the number of beds being occupied, but it's certainly a far way from any assumption or perception that the COVID wards or COVID beds, which essentially are isolation areas, have been exhausted. We still have sufficient capacity to deal with additional cases that require hospitalization.
Dr. Tufton made the statement during his ministry's COVID-19 digital press briefing Sunday night. Meanwhile, Director of Services at the National Public Health Lab, Dr. Michelle Hamilton, says the backlog of COVID-19 test samples has been cleared.
The reagents for the COBA 6800 that we spoke about, the last press briefing, did arrive in Jamaica on schedule, and so we have been able to clear the COVID-19 backlog of samples.
Dr. Hamilton made the announcement during a virtual press briefing last Thursday. She said the reagents received were enough to clear the backlog, as well as to deal with routine surveillance and all the other new investigations that will be required.
In short, we have surge capacity in the system, and we will be able to ramp up the testing as required.
In other COVID-19 related news, government is closer to engaging additional healthcare workers to boost its response to the pandemic. Health and Wellness Minister Dr. Christopher Tufton says this relates to the 120 medical officers who recently graduated and had no post.
I'm happy to announce that that process has moved along now to the extent that we are in a position to engage these persons over the next week, I'm told, by the team here, and that will mean more staff who will be deployed across the country, and that would strengthen the response to dealing with the challenges of COVID and other challenges that we face.
Dr. Tufton gave that update after reporting that there were 17 confirmed cases of COVID-19 among healthcare workers across the country. 8 are at the Kingston Public Hospital, while the remaining 9 cases have been recorded in other hospitals. The minister acknowledged that the rise in cases was impacting hospitals and putting more health workers at risk. But he said there was a plan in place to deal with these situations, and that has been activated.
We expect that these things will happen from time to time. So it is not that we are searching for solutions. We are working through the solutions based on a process that is decided on prior to these eventualities occurring.
Ahead of Sunday night's newest COVID-19 numbers, Prime Minister Andrew Holness announced tighter curfew hours for Kingston, St. Andrew, St. Catherine, and Clarendon. As was previously announced for St. Thomas, these parishes now have a daily curfew of 7 p.m. to 5 a.m. until September 2. The curfew for all other parishes remains 11 p.m. to 5 a.m. daily.
The virus is spread by people who are infected, gathering, greeting, embracing, coming into close contact, but also sharing transportation space and moving about. If we limit movement, we have a greater chance of limiting spread. And the curfew does help to limit movement, particularly at night.
The Prime Minister was addressing a virtual press conference on Friday. He also announced that measures earlier instituted for St. Thomas now apply to Kingston, St. Andrew, Clarendon, and St. Catherine, namely, no funeral, convention, or other civic services at churches. Regular worship is still allowed, and burials will continue with strict enforcement of the 15-person rule. As the country moves closer to the September 3 national election, Prime Minister Andrew Holness has announced that political motorcades have been prohibited in a bid to contain the spread of the novel coronavirus.
This is to say that motorcades with more than 2 buses, which we call coaster buses, motorcades that are stopping and greeting, motorcades that are carrying persons by bus, that will be prohibited.
To enable political parties and their candidates to continue campaign activities in communities, the Prime Minister said community drive-thrus would be permitted.
We will allow drive-thrus, meaning that the political party should present a route to the police commander in charge of the respective areas they intend to tour, and they can drive through but not stop and greet. So it would be merely a driving through, displaying their signs, banners, paraphernalia, but there will be no stopping and greeting, so there should be no gathering at any point.
He warned that the police would be monitoring the new restrictions, and if breaches were found, all such campaign activities could be banned. And finally, the Judiciary of Jamaica says night courts in St. Catherine, Clarendon, Kingston, St. Andrew, and St. Thomas have been suspended because of the new curfew measures imposed in these parishes. Persons who had matters scheduled for night courts in those parishes are being asked to contact the respective courts for additional information. The Judiciary is also encouraging staff and members of the public to adhere to the COVID-19 protocols outlined by the Ministry of Health and Wellness. The parish court contributes significantly to the administration of justice in Jamaica in the adjudication of many civil and criminal matters daily. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.